Dr. Harvey White is with us again, another conversation about cardiovascular health. Great info. I hope you stay around for this episode. And Dr. White is founder and executive director of Vessel Health here in New Mexico, a preventative cardiovascular practice. We're going to get people before they get into trouble with their heart.
Yes, and I think today, am I right, we're going to talk about PAD?
Yes. You have me at a loss because I've heard of it. Peripheral Artery Disease.
That's right.
I just told you everything I know.
That's right.
So you're going to tell us about what this is.
That's right. We're trying to make an impact with this PAD thing. But,
okay.
I'm not sure how far we've gotten. You know, thinking about PAD, Larry, I think it's one of the worst artery problems in terms of us not having any good therapy for it. And consequently, to me, it's as important as any in terms of this prevention concept. Well, you know, Larry, let's talk shop a little bit about PAD, peripheral artery disease.
I want to learn something.
Again, as I mentioned, it is a worrisome problem. We don't have any good fixes. So let's talk about it. This is the beginnings of the peripheral artery system. And as you remember, the heart is up kind of where my heart is.
Okay.
It sends blood down to each of the kidneys.
Right.
It goes below the belly button and then goes down both legs.
Okay.
There are certain people that are particularly prone to PAD or peripheral artery disease, and the number one group are smokers. People that are exposed to nicotine over and over and over and over.
Okay.
And I'll explain why that's an issue. But peripheral artery disease are blockages that develop often anywhere from the distal aorta, or that's the end of the aorta here, to these vessels we call the iliac arteries that go down the legs.
Okay.
And as I'm going to show you in a minute, all the way down to the toes.
Okay.
All the way down to the toes. How does that become appreciated? An individual generally notices that they get discomfort in their legs when they walk. That's the number one issue.
What kind of discomfort? Numbness or tingling? Or?
No, it's more of an ache. It might come about in their calves particularly.
Okay.
And then they walk, they get that ache, they stop, and it goes away. It's very similar to what we call angina or angina.
Yeah,
We didn't really cover that much, but it's angina of the legs.
Okay.
You can also, though, as you might imagine, like with the carotid arteries and stroke, have little pieces of this plaque go down to the feet. And there are podiatrists that see issues of gangrene, actually, or blockages in the toes.
That occur from this. Wow.
It's not good.
Yeah.
Not good. So that's a little bit about the part of the aorta, the iliac vessels. But I should also mention, while I have this out, that the aorta can also not just have plaque, but if plaque gets in the wall of the aorta, it can actually bulge and create an aneurysm. And that's also a type of PAD, which is an aneurysm of the aorta, which can burst and people can expire.
Yeah, serious. Now, let's talk about the aching of the legs.
Let's go with it.
What can we do to prevent PAD at this point?
If you go down the legs, all right, from that bifurcation or division, these blood vessels that go down the legs, the striking thing about PAD is it rarely occurs in little spots like that, okay? It often is extensive and diffuse. That means it's all over the place. Consequently, it's very hard to fix, like with an angioplasty or stent. And we have to get people before they've gotten to this point. In some, unfortunately, they may live with the pain, or if worse, there are people that need amputations if it gets really bad.
Wow. This is a side of cardiovascular health that you don't hear a lot about.
We've tried to make people aware of it. And in truth, we have a hard time even making physicians aware of it before symptoms develop.
If you want to know more about PAD, its effects, its symptoms, be a good idea to talk to this man right here, Dr. Harvey White at Vessel Health, and people can find you at Vessel Health. What number?
Yeah, our telephone number, Larry, is 505-828-3000, and we have a website. It's informational. That website is Vessel, VESSEL, NM, as in New Mexico.com.